Hello, good morning, good afternoon, good day to everybody. Thank you for joining us today for our Turning Lessons into Action, a national convening introducing the RADx-UP Public Health Emergency Preparedness Playbook. Next slide, please. So before we begin, we would all like to know who is joining us today. So if you can and are willing and able, can you please share your name, your organization or institution in the chat? And a nice little icebreaker, if a zombie apocalypse hits, what role are you playing on your team? So if any of you all are fans of The Walking Dead, I would like to consider myself a Rick. And maybe that's thinking very highly. We'll take some time for you all to introduce yourself in the chat.
Hola, muy buenas tardes. Si por favor pueden presentarse en el chat, puedan incluir su nombre, su organización y para un rompehielos rápido, si son famosos de The Walking Dead, por favor escriban cuál sería su rol que ustedes tendrían en caso de una apocalipsis de zombies.
Also want to share my apologies, taking a step back. For those who may need Spanish interpretation, we do have our Spanish interpreters online now, and they will provide instructions on selecting a language channel. So David, I'm not sure if you dropped those instructions already, but we can share them again.
Yeah, can I have 2 minutes for verbal instructions? Thank you. Hello, everyone. My name is David Cruz, and I'm here with my colleague Alejandra, who will be providing instructions in English and in Spanish on how to access the interpretation. If you are accessing this call through a computer, you will see a globe on your bottom panel on the right side that says interpretation. Please select the globe and select the language of your preference if you are not bilingual. If you are accessing this call through a smartphone or tablet, you're going to lightly tap the screen to activate the menus at the bottom part of your screen. Slide that menu to the left until you find the 3 dots that say More. Click on the 3 dots and you will see a new menu pop up where the interpretation feature option will appear. Select the interpretation feature. A new screen will open up where you'll be able to select the language of your preference. And don't forget to mute original audio if you would not like to hear both languages at the same time. Don't forget to click Done on the upper left or right corner of your screen. And just as a friendly reminder, to maintain language justice and quality of interpretation, to please maintain a paced speech whenever we are participating and to speak clearly so that interpreters can maintain quality of interpretation. Hola, muy buenas tardes. Me llamo David Cruz y aquí estoy con mi colega Alejandra, quienes vamos a ser sus intérpretes el día de hoy. Para accesar esta llamada con la función de interpretación y si está en su computadora, por favor seleccione el globo terráqueo en el panel inferior de la mano derecha de su pantalla, donde usted podrá seleccionar el lenguaje de su preferencia, ya sea inglés o español, y le alentamos encarecidamente de que si usted no es bilingüe, por favor accesar la función de interpretación. Si usted está accesando esta llamada a través de un teléfono inteligente, una tableta o un iPad, por favor toque levemente la pantalla para activar los menús en la parte inferior de su pantalla. Deslice ese menú hacia la izquierda hasta que encuentre los 3 puntitos en la parte inferior de la mano derecha de su pantalla que digan más o more. Usted le da clic a esos 3 puntitos y va a desglosar un nuevo menú donde usted va a poder ver el globo terráqueo de interpretación. Seleccione el globo terráqueo y va a abrir una nueva pantalla donde va a poder seleccionar el idioma de su preferencia, inglés o español. No se le olvide apagar el audio original y también seleccionar listo en una de las esquinas superiores de su pantalla, del lado izquierdo o derecho. y un recordatorio solamente para mantener la calidad de interpretación de cuando uno esté participando, de hablar claro y con una velocidad amena para mantener la calidad de interpretación. Muchas gracias. Y si tiene algún problema accesando la función, déjenos saber en el chat. And if you have any problems accessing the interpretation feature, please let us know in the chat and we'll do our best to help you.
Beautiful. Thank you so much. I see all the chats coming in, so thank you all for participating. May you go to the next slide, please? So hello all, here is our beautiful agenda for today. We will start with the introduction of all of those presenting, and then we'll dive into the CCPH background, RADx-UP and CDCC, playbook introduction, panelist discussion, and then we'll end with question and answers. And in the meantime, in between time, if you do have questions that come up during today's presentation, please feel free to utilize the chat function. And with that, I will start with introductions. So I will start with myself. Hello all, my name is Aaliyah Hill. I use she, her pronouns. I am an engagement specialist with CCPH, and I'm happy to be here and representing CCPH and the RADx-UP team. And I will pass it to my colleague, Alan Wells, to introduce himself.
Good morning. Can you hear me okay?
Yes.
Good. I'm Alan Wells. I'm research and evaluation specialist for CCPH. And my background is I was a professor in medicine for 20 years. And this job for the last 4 years working on RADx-UP has helped me transition into research and the NIH on a national level. I've enjoyed very much. It's wonderful to have you here today. May I pass to our director of CCPH, Al Richmond, please?
Good afternoon. I'm Al Richmond, Executive Director of Community Campus Partnerships for Health, and I'm based in Raleigh, North Carolina.
Thank you, Al. I'm pass it to Leah.
Hello, my name is Leah Kaz. Not to be confused with the wonderful Aaliyah, so if you address either of us a question, we'll do our best to know who you're talking to. I am Senior Clinical Research Coordinator at UNC. Happy to be here. I've been on the RADx-UP grant since 2021, background in social work.
Thank you. Marcus?
Hello all, my name is Marcus Lair. I'm a project leader at the Duke Clinical Research Institute in Durham, North Carolina. I also have the pleasure of working alongside a lot of these wonderful presenters in the playbook development, and I'm excited to share about how we brought it about.
Thank you. And Crystal?
Hello, everybody. My name is Crystal Cannon. I am a program manager on the RADx-UP program at Duke Clinical Research Institute based in Durham, North Carolina, and so excited to be here and be a part of this convening.
Thank you. And then Sharice?
Oh, hi, everyone. I'm Charisse Iglesias. I am the Training and Resource Director at CCPH. I'm happy to be here. Thanks, Aaliyah.
Okay. And then Janet?
Hello, my name is Janet Casper. I'm the Director of Community Impact with the United Way of Merced County in California.
Thank you. And Angela?
Hello, I'm Angela Dunston, and I am a community engagement coach and a specialist. I'm also a founding member of the Warren County Environmental Action Team in Warren County, North Carolina. Thank you for allowing me to be here.
Okay, thank you all for those introductions. We will dive deeper into who everyone is during this presentation. Next slide, please. So thank you all again for joining us. The learning outcomes we hope you take away from this convening is first, reviewing the rapid acceleration of diagnostics in underserved populations, also best known as RADx-UP, as we study the study and its impact with the populations. Describe the Sankofa project and making the playbook and introducing the playbook content. And then third, discuss dissemination and adoption of the playbook by public health practitioners, community-based organizations, and academic partners. And with that, I'm going to pass it to Al Richmond, CCPH Executive Director.
Thank you, Aaliyah. I appreciate the opportunity to join you today and to be a part of this discussion. I want to just kind of go back in time, actually, prior to when many of you actually were or even aware of RADx-UP. I want to just kind of share some seminal dates and just kind of put some things in context. It was on August 7th of 2020 that we submitted the RADx-UP application. This was after convening a really new and exciting partnership between Community Campus Partnerships for Health, CCPH, the Duke Clinical Research Institute, and the University of North Carolina at Chapel Hill. This was indeed a bold venture in response to the global pandemic. This was the largest commitment on the part of the National Institutes of Health to address health inequities and disparities here in the US. At that time, some of you may remember that there were communities that were disproportionately impacted and affected by COVID-19. We came together in this bold opportunity and venture to submit an application in response to the RFP. On September 17th of 2020, we received what is commonly known as a just-in-time request. A just-in-time request is sort of a formal notification that you might be funded, and we responded to that in short order. And in September of 2020, we received notification that the Duke Clinical Research Institute, as the lead organization, had been selected to lead the RADx-UP Coordination Data and Collection Center. So I wanted to go back in time to bring us up to time where we are today with one additional note, and that is on November 12th, 2020, our RADx-UP website went live. And so I'm excited about the opportunity to share with you how we got to where we are today and to provide some additional context to our work. A word about Community Campus Partnerships for Health. Our mission as an organization, we're 27 years old. We were founded as an organization by a postdoctoral student, Serena Cipher, to really bring together partnerships and to build partnerships between academic institutions and the community. Our mission is that of health equity and social justice. We believe that partnerships are the way to move forward. This image that you have is a few of our team members who actually were recently here in North Carolina to attend a community event. Next slide. Additionally, about CCPH is that we solve problems or we solve challenges that partnerships that are just inherent to partnerships. The first one is a lack of trust between communities and institutions. And so when looking to an organization to mitigate these issues of mistrust, we're the organization to go to. We also focus on equal power dynamics and research partnerships, which are inherent in all partnerships. There's also an area that we focus on, and that is a limited capacity for stay and community engaged collaboration. And finally, the disconnect between public health research and real world impact and application. Our focus areas include building and restoring equitable, trust-based partnerships, leading capacity building efforts that strengthen community and academic collaboration, and supporting community-driven research, policy, and practice that leads to sustainable change. Next slide. Again, in 2020, Community Campus Partnerships for Health, along with the Duke Clinical Research Institute and the University of North Carolina at Chapel Hill, joined together to form the RADx-UP CDCC. Our role specifically was that of providing technical assistance and training on equity-centered community engagement. supporting grantees, and there were over 120 grantees that were a part of the project, and building trust and strengthening partnerships with communities. These included academic institutions, health departments, and other institutions. And then to co-develop resources like the RADx-UP Playbook that we'll be talking about today. We facilitated webinars and convenings. Our impact is that of helping over 130 RADx-UP teams to embed community wisdom, transparency, and accountability in this national public health response. Thank you.
Thanks, Al. The RADx-UP program was actually a part of a broader initiative, or RADx initiative, that was funded by the NIH to speed innovation in the development and implementation of COVID-19 testing technologies. In addition to RADx-UP, the other RADx programs included RADx-Rad, RADx-ATP, RADx-Tech, and the RADx Data Hub. With its emphasis on health equity and community engagement, RADx-UP aimed to build sustainable strategies for public health emergencies, including expanding COVID-19 testing access, addressing barriers, and implementing innovative solutions that were tailored to specific community needs. And as Al mentioned, the RADx-UP Coordination and Data Collection Center, or CDCC, was a collaborative effort that was led by DCRI, UNC, and CCPH. The CDCC supported over 130 community-driven projects across urban, rural, and tribal communities by providing data infrastructure, testing and technical assistance, as well as community engagement strategies. Next slide. So RADx was a 5-year initiative funded by NIH to ensure that all Americans had access to COVID-19 testing, particularly communities that were most affected by the pandemic. To achieve this, the NIH RADx-UP funded projects were launched at different phases of the pandemic and had varying focus areas. Many of them targeted expanding equitable testing access. Some focused on social, ethical, and behavioral influences of testing, while other projects concentrated on returning students to school safely. The CDCC also funded projects to extend their reach into even more communities and increase community capacity to implement programs and support community engagement. One of the mechanisms for doing this was the Rapid Research Pilot Program, which provided up to $200,000 to conduct research to improve testing access and uptake in underserved communities. Another funding mechanism was the Community Collaboration Grant Program, which provided up to $50,000 to support community-driven projects to advance capacity, training, and community support for COVID-19 testing initiatives. And lastly, the Say Yes COVID Test Initiative provided free at-home testing kits to communities with high local infection rates. Next slide. So here we have RADx-UP by the numbers. And to give you an idea of the scope and the scale of the program, I'll just highlight a few of the metrics that are shown here. The CDCC awarded 25 rapid research pilot projects and 70 community collaboration grants, which helped the program overall to reach across 53 states, territories, and Washington, D.C. We provided over 270 community engagement resources in an online library and enrolled over 400,000 participants and conducted over 400,000 tests directly with those participants. Next slide, please.
Hi, Crystal. Sorry, just want to remind everyone to slow down a little bit for our interpreters.
Thank you for that reminder. So on this slide, this figure shows more insight on the range of communities that were reached by the RADx-UP program. It also demonstrates how community engagement advanced equitable access to testing locally and nationally. The figure highlights how trusted partnerships quickly mobilize interventions and enhance community acceptance and enhance readiness for participants to participate in research, which I think reinforces the significance and importance of these types of initiatives to help fill the gaps to support underserved communities during public health emergencies. So with that, I'll pass to Marcus and Leah to discuss more about the development of the playbook for public health emergency preparedness.
Thank you so much, Crystal. And like Crystal said, my colleague Leah Cass and I will be discussing the Public Health Emergency Preparedness Playbook development. Next slide, please. All right, so during pre-development, we needed to come up with a strategy to compile and share our lessons learned. Our methodology was inspired, or AKA our North Star, by the principle demonstrated with the West African word Sankofa, meaning one should retrieve things of value from our knowledge of the past to make positive progress in the future. Hence, we began with a four-phase process depicted here. As you can kind of see, it's kind of broken up where in phase one, we really prioritized engaging in our consortium. Phase two included the inventory and assessment of our assets, which we learned by doing over the course of a year that proved to be a very critical yet challenging endeavor, which Leah will go over in the upcoming slides. Phase three was the curation of our legacy outputs. And then phase four was the dissemination of our legacy outputs. Next slide, please. So our engagement with the RADx-UP consortium wasn't just something that we did in the beginning. It actually was throughout the entire process. Our journey began with visioning sessions, which took place back in the fall of 2023, where we first were informed through our interactions with various partners that the desire for a playbook was identified. And through those conversations, we also were able to develop 9 different learning categories and define audiences. Next, during the summer of 2024, we established a task force to curate the content based on the resources that we compiled or did inventory of, which was our asset index, which you'll hear about more momentarily. One important thing about the task force as well is that we also provided our members with multiple ways to engage with providing feedback. So folks were able to attend virtual sessions just to provide like informal feedback. In addition, if they so desired, they can also be contributing authors and provide like direct edits and comments to the content as it was being drafted. After the playbook was drafted, we conducted message testing sessions, and this happened during fall of 2024 to ensure best practices as it relates to our outreach and dissemination. Next slide, and I'll pass the mic over to Leah.
Hello, everyone. Thanks, Marcus, for that overview. I'll be speaking about phase two, how did we inventory and assess our assets, and a little bit into phase three, how did we curate those? So the good news is that throughout this grant process, a ton of materials were made through this highly inclusive process. We had about 400 items that we wanted to organize. The challenge, as you might imagine, is how do we stay organized and make sure that this is user-friendly, that we are setting ourselves and our communities up for success for people with different backgrounds to use the playbook differently. We have about 260 or so assets referenced in our playbook, and more than 300 that will be for public access post-grant. We developed this index internally, and I'll speak about that organizing schema in just a moment. And we've been partnering with the NIH, our funder, for a searchable public platform, as we always have been rooted in community dissemination. We recognize that manuscripts are not the only way to get the good word out about the good work being done. So below here, there is a table referencing how we organized our materials. It's very important in assessing our assets to list what do we have. Keeping some of these columns standardized across different materials was super helpful. Our coordinating center was split into cores, essentially meaning the type of focus. I was on the community engaged research core. There was a testing core, a data core, an administration core, and then other services. I'll skip ahead to making sure that the audience is clear for each item. For community audiences, they might have different interests than academic or funder audiences. Materials will still be available, but being able to filter by user was feedback that we got. Making sure that all of our materials had a unique name and a unique description helped keep things straight. And here I'll just list for anyone trying to replicate this, keeping track of quality control as things are developing and changing and edits are coming in. It's very important that if you offer people the opportunity to give feedback, you note that feedback, you incorporate that feedback. So we were vigilant in making sure that we were taking those notes. And some of these resources were internal or external. So congratulations, you've survived the spreadsheet content of the presentation. You did it. And I'll ask us to please go to the next slide. Thank you. I'll talk quickly about phase 3, the playbook itself. So now that we are organized, how do we get this information out there? What did thousands of people learn across 5 years? The objectives of the playbook were to present strategies for rapid and evidence-based responses to health crises. Part of the emphasis was health equity and engaging and working with and learning from underserved or medically marginalized communities. If you remember the dates that Al gave you, our coordinating center was funded within 2020, so that rapid piece can't be understated. We wanted to provide key resources and findings to be applied to future community engagement research and public health efforts, particularly looking at health disparities and equitable access to resources and information. It was essential to engage community partners and stakeholders or other interested partners to co-create and review the playbook and its dissemination. It was critical that we didn't build a playbook and then ask, so do you like it, right? This was from the beginning integrating and partnering with people with very different levels of experience. We also, with a preparedness playbook, wanted to prepare a community engaged research model of collaboration within a public health system and research institutions to make sure that these perspectives and priorities, these knowledges, are consistent and integrated into decision-making processes. The RADx grant was unique in its landmark investment in community engaged research, and that is a critical part of this playbook. And some of the book also does advocate for policy changes and institutional reforms. So you can think of big P and little p policy that support health equity. And with that, I think I will pass on back to Marcus. Thank you.
Thank you, Leah. Next slide, please. All right, so now we made it to phase 4. So given the importance of the research conducted through the RADx-UP program with recommendations and guidance for future community engaged research and pandemic preparedness, it is important to close out our efforts with a comprehensive dissemination plan, which is still ongoing currently. But as our next steps, we plan on sharing our final tools, playbook content, insights with both our community and academic partners in accessible formats. Just to kind of give a little bit more detail about that, case in point, our RADx-UP Playbook will be permanently housed publicly on the RADx Data Hub that's housed with NIH. We also plan on to support our partners in integrating legacy outputs into ongoing public health efforts and emergency preparedness plans, to also promote widespread dissemination through webinars like folks who are attending the session today, social media, and national conferences. And then lastly, to encourage community-led storytelling and evaluation to reflect real-world impact and lessons learned. And with that, next slide, please. I'll pass the mic over to Aaliyah Hill, who will talk about the layout.
Hi, y'all. So like Marcus was saying, the playbook will be housed in the RADx-UP location. As well, I want to give a layout of the playbook. I like to think of this as, you know, the commercial before the big movie comes out. Next slide, please. So what should you expect to be inside of the playbook? The playbook is separated into 4 different sections. Section 1 will be setting up the program. While the programs listed in Section 1 may be COVID specific, I want to let you all know and provide the reminder that the program can be in place of any public health emergency you may be facing. We want to make the playbook as applicable to modern day situations. So Section 1 is setting up the program, establishing and mobilizing an effective community engaged program, and then strengthening partnerships. And then we move on to Section 2, implementing the program. Who all should be at the table and implementing the programs we are needing? That can be data collection, supporting testing, best practices. Section 2 lays out how to implement the program. Then Section 3 dives into sharing the results. We did the work. Now, how do we share the results of the work so we continue learning? So this will be sharing information and communicating clearly and policy and practice. And then the last section, evaluating impact. If any of us have worked with grant funders, we understand the need for evaluation. So Section 4 dives into evaluating impact with program evaluation, position for sustainability, and then closing and beyond. We want to keep learning and keep growing and be prepared for the next public health emergency. Next slide, please. Now I'm going to pass it to my colleague, Alan Wells.
Hey, everybody. So I'd like to introduce the panelists and also remind everyone that the playbook is being finalized this week. We will be active on the NIH website and also on the CCPH website in July. Luckily, we have with us today 2 people that know each other very well from other things and also from working on the Say Yes COVID test endeavor, which was highly successful. This study really gives evidence that the community engaged approach works in research or outreach. If you want to reach people, build strong partnerships. And I don't know 2 people better equipped to talk about these issues than Angela Crump-Dunstan and Janet Appling-Kasper. Let's start with Angela. Angela is a pioneer in the environmental justice movement. She mentioned she was the leader in Warren County, North Carolina, which was the start of the environmental justice movement in North America. She's also worked for the governor and the first female governor of North Carolina. She was a people's advocate, lobbying at the state level alongside grassroots organizations. Overall, Angela has contributed to health equity by consulting in the health research sector, focusing on initiatives aimed at achieving equitable healthcare access for marginalized communities. And during the COVID-19 pandemic, she played a crucial role in the success of an NIH-funded prevention project, as I mentioned, Say Yes COVID test. Her current efforts emphasize ensuring culturally competent and high-level, high-quality healthcare for underserved populations. So that is Angela. I have the pleasure too to introduce Janet Applin-Casper, who also has a very long resume of public service and community engagement. She's an experienced community leader, entrepreneur, and retired civil servant. Her career spans project development, program administration, and community engagement across nonprofit and governmental sectors. She is currently serving as the Director of Community Impact at the United Way of Merced County. She has a strong record of reporting large-scale volunteer initiatives through Merced County Human Services, overseeing programs supporting seniors, foster youth, veterans, and health insurance counseling. She has a passion for leveraging trusted local networks, from food distribution events to barbershops, to amplify public health messaging. Janet is a versatile leader who blends strategic insight with hands-on community engagement to drive meaningful, equitable impact. And we're delighted to have you here today. And I'm going to turn it over to Leah, and we will have a moderated discussion with the panelists. Thank you.
Beautiful, beautiful. Thank you. Thank you all again. So as we transition into the conversation portion of our webinar, we want to create a space that feels honest, respectful, and rooted in shared learning. Our goal isn't just to present information, but to connect, to reflect, and to challenge ourselves and each other's in service of equity, impact, and action. So please feel free to use the chat to share any questions, comments, and reflections you have for our panelists. The following questions are meant to guide our conversation, but we are not written in stone to these questions, so please feel free to share any you may have in the chat. So with that, to start, hi, welcome panelists.
Hello.
To start, in your own words, how would you describe the playbook's value to your community or organization?
I'll jump in. First, I want to just start by saying hello to everyone and thank you to CCPH, NIH, and everyone who is a part of this effort to ensure that we continue to do good where there is so much need for it to happen right now. I do have to start by saying hello to my good friend Janet. And just to give you all a little bit of a background story, Janet and I worked together on the COVID project back in 2020. We did all of the work virtually. We have never met in person. But because we were both such committed to the important work of taking care of people in our communities, we developed a friendship, a sisterhood that I believe that spans beyond miles and beyond time and beyond a virtual platform. And so again, thank you so much, Janet, for all that you did during those initial days when we were working hard to ensure that people's lives were saved. And who knew that down the road we would be here developing this playbook, but also still continuing to do good work. So thank you for that.
Thank you.
I will now say that, I think light attracts light. And so I have continued to work in this space around many, many issues. As Alan said in that introduction, environmental justice is an issue that is at the heart of who I am. I grew up in the environmental justice movement in Warren County. And for those of you who aren't familiar with the story, please take some time to do some research. But it started with I'll just say, unscrupulous company who decided that they would dispose of the toxic cancerous chemical PCB along the side of the road in counties all across the state of North Carolina. And the state of North Carolina made the decision to dig up that soil and to plant that soil in Warren County. And so for 40 plus years, my family, my friends, my community, we have been advocating for the injustice that was done to Warren County by dumping that soil in our community. And so I think it's not ironic that when the pandemic happened, I happened to be in a place and in a space, and again, knew Mr. Al Richmond, and knew of his work and his commitment to the cause to help people. And so I happened to be chosen to work on the project of trying to disseminate COVID tests, but also to get people tested. And so as we talk about what is now almost a full circle moment of utilizing this valuable tool, this playbook, to now make an impact in so many other issues that are happening in our community, whether it's a natural disaster, whether it's disease control, whether it's for many of us who are experiencing this heat crisis that is currently happening in our country. I'm actually in Washington, D.C. right now, and it's 100+ degrees. And so we think about what that crisis will mean for so many individuals and so many communities. Having a tool like this as people work to resolve this issue is a valuable asset that we can utilize when we talk about organizing communities, engaging communities around not only just a healthcare crisis, but a potential disaster should this heat wave continue. And so this toolkit is an opportunity for communities all across the country to utilize it to resolve issues and challenges and problems that they face. And again, I'm so proud of CCPH and all of you all who have been a part of this development in allowing us to have this type of tool that will help communities all across not only just the United States, but hopefully across the global continent.
Thank you, Angela. You're so awesome. Janet, would you like to weigh in on the same question?
The same question. So I can. I gotcha. So shortly after 2020, 2021, and we are sort of, I don't want to say we came out of COVID, but we're sort of rolling out. My community was hit with massive flooding. Flooding to the point where it wiped out a farm worker / laborer community was underwater, as well as a trailer park which had senior citizens that lived there that were all very low income. And it took out over 1,000 homes over in that, or I should say flooded 1,000 homes in that area. So we were able to take what we had learned during a 2020, 2021, which is those lessons learned, which are going into the playbook. We were able to take those lessons learned and use those for our flood event. And we started putting a few of those things in play. What worked, what didn't, terrific. And then 2024, we got hit with a huge fire. So again, we were going back to lessons learned on the RADx program pieces, and we're able to take more pieces and bring those forward. Because when we did gather those individuals who had been affected by the floods and the fires, we found health issues with a lot of them. We needed to get other resources and bring in our other community partners. And so, as we know, the playbook isn't complete yet, but many of us are already using little pieces of it and kind of weighing out, hey, this is still working. And yeah, it wasn't just because of COVID and people were locked up in their homes. It was, hey, it does work on the outside world as well.
Janet, please go ahead with the next.
Thank you both for that. And I wanted to also ask, and we can start with Janet, and you both briefly touched on this, but when the playbook, which is set to be released here very soon, how do you plan to introduce the playbook to your community partners and networks?
Oh, perfect. So we've actually already kind of started, and since we did You and Me COVID free and say yes COVID test, we had brought in several community partners, and the community partners, we continue to meet on a quarterly basis just to find out what's going on in the community and such. But we've also been discussing the playbook. So they're aware it is coming forth. Also, in order to get them kind of ready for it, as we all know, everybody has a what's in it for me. And so a lot of my community partners are not in public health. And when they see public health on a document, it's like, not for me. And so what we've been doing is discussing how, just because this is going, just about everything we touch does touch public health. And because public health isn't in your title or in the name of your organization, that doesn't mean you're not touching that piece. Besides that, you can always take the playbook and take pieces and see how that is reflective of the work that you do. And as a matter of fact, our fire marshal and emergency operations office have asked to have somebody from their offices sitting on our committees awaiting this type of information. So we're super excited. Our community is still very, very much involved in the processes.
Janet, one thing that you had mentioned earlier in a meeting with me is that you included people that you usually wouldn't think of for things like this, such as the police and the government, and maintaining that open communication and channels with people that pick up the phone to look for information in Merced County. Could you discuss your network, like who you're going to call?
Sure. So in Merced County, and actually in the counties in which, everybody who is on this call, you can pick up your phone, so you can call 211. 211 actually goes to United Ways. And each community has their own 211 system. And so that is one of the areas or things that people do to get information. Now, because I am retired out of the counties of Merced as well as Madera, and have worked quite a bit with my elected state and federal officials, we have a seat at the table. So anytime that there is a disaster, be it a trailer park that is privately owned has caught fire, where government can't touch it because they can't help, it's private property, or if it is a federal disaster, the local government has given us a place at the table. And it didn't come easy. I had to ask for it. And I had to ask for it. And now here I come shining myself at 3 a.m. in the morning to the table. But it was building those relationships. Granted, I had to step up because I retired from the county 4 years ago. But still, it is massaging those relationships. And it has made a huge difference for us and the people that show up for any of the convenings that we're partnering on. It's kind of, some people find it humorous and others are impressed because it is quite a mix of individuals that come to the table, including a lot of our homeless advocates are there with us now too, which we all know how important that is to get that population in for health reasons as well, housing and the whole 9 yards.
And Angela, I'm gonna pass the same question to you. How do you plan to introduce the playbook to your community partners and your networks?
Gotcha. Thank you so much, Aaliyah. And actually, when I thought about ensuring that everyone has access to this valuable tool, The immediate group that I wanted to ensure that has access to this playbook are the original partners that we brought to the table when we were working on the COVID-19 project. And it's, apropos perfect that Janet is here. She was one of them. But there were so many other partners across the country that we want to make sure know about this tool and get to utilize this tool. And one of the groups that I think about is a group out of Hawaii. And as we all know, what the numbers were, and unfortunately the deaths were in Honolulu, that's one of the specific communities that I want to make sure that we engage. But there were people from Greenville, North Carolina, people from Hamilton, Tennessee, people from Georgia, people all across the spectrum, that those are some of the first partners that I think that I should make sure have access to the tool. But in addition to that, I'm also doing work across the country with many other community groups. And I want to make sure that all of them have access to the tool, understand the value of what is in it, how they can utilize it to address many of the challenges that they are facing. And then hopefully what I'm seeing is almost like a trickle up, but not a trickle down mode of communication. Those individuals and those partners will then share it with other partners. And so I can definitely see that the playbook will be dispersed all across, again, the country for every organization and every entity to be able to utilize it.
Janet, you had mentioned that you wanted to, one group that we didn't think of is your medical societies, and Merced and your family doctors.
So we actually have got our medical association, which has about 90 of our physicians' offices in it, and they are at the table. We have about 3 little hospitals. They're all at the table now. We have got a meeting with several of them on the 18th of July. They'll all be there. But yeah, we have our medical community has come forward, as well as public health and our managed care systems. We have brought in our insurance companies into the mix as well. Because besides being able to give them this information, I like things that are kind of have a backside too. So it is allowing for the connection of our physicians or our CalAIM providers to meet and see the managed care providers. And it makes it a little bit easier when you're having to call and get an approval for some insurance for a procedures, and it makes it a little bit more personal. Now, granted, we are in a county that the entire county, we're really sprawled out, rural area, with around 200,000 individuals in our county. And then I also cover the county next to me, which goes up into Yosemite National Park. And I've only got 17,000 individuals up there. So, for us, getting our physicians to come in through the association really was great. And they are well aware of it, as well as our public health departments. And social services.
Mm-hmm.
Thank you both. And I want to pivot from our guided questions and answer a question we received in the chat. And I will direct this to Angela first. With your work and just your background and experience in implementing the playbook, are community organizations voting or helping to make these decisions that will directly impact them?
Can you repeat that, Ali? Our community?
Are community organizations voting or helping to make the decisions?
And I know it's in the chat, but will you clarify voting, a little bit more clarity around the question?
Yeah. So when you are providing resources, and here's a little bit more background, the participant asked, they are curious about community members' power in making final decisions. Are they voting? Are they not voting? Are community members included in and invited to help make final decisions? Or are they only consulted?
So, many of the organizations that I work with are community-led organizations. And so, of course, having community being empowered and having a voice in the decision-making process is at the forefront and centered in all of the work that I'm doing with many of those communities. And so, yes, they are at the forefront of voting, deciding how decisions are being made, deciding what tools and resources are that they would like to utilize. And again, in my opinion, I think the playbook is one of those that centers that. When we originally were brought to the table to be a part of this, one of the things that, and I appreciate so much from Al and the CCPH team, is that they knew and understood the value of community having a voice and community being a part of designing and implementing the community engagement work that we were doing. And so that is a principle that has continued in the work that I'm doing, not just, even before I came to CCPH, again, being a part of a movement of justice, especially around environmental justice. And so community is at the center, is in the middle, and is at the forefront of any and everything that is and will be done.
Janet, did you want to also add to that how your community members are incorporated with final decision-making processes?
Okay, so like I said earlier, we meet at least quarterly and we have discussions. Everybody's voice is heard. And I take that information back to whichever project that we're working on. I'm very vocal about this is what my community wants. And sometimes it goes over well. Sometimes I have to argue a little bit and justify why, because a lot of times if you're not boots on the ground, hands-on service, sometimes you might not understand why the community is asking for something to be done a little differently. And so we always bring everything forward by the community. As a matter of fact, here in Merced, I'm getting ready to build a park, and I've brought everybody that lives in that neighborhood together. They're going to pick out what the design is going to look like, what we're going to have. So I'm huge with bringing my community together. This also, by doing so, you develop a trust, and that trust with your community is huge. I did during 2020, we were starting vaccination clinics. I put a call out. I had over 600 volunteers throughout California came to my small county to assist with vaccination clinics. Unheard of, but they were all here to help. And it is because they know we listen and we bring their thoughts and their ideas forward. And they're more than welcome to go ahead and relay those messages themselves if they don't want to use me as that conduit.
And Aaliyah or Alan, and if I could just jump in, I just want to reiterate what Janet said about trusted individuals in the community who are part of this engagement. I may be the person who is bringing the information, but for me, it is working with whoever that trusted voice, leader, advocate, whatever title you would like to give that person, working with that person to ensure that this is what the community wants, this is what the community needs, and this is where the community would like to go. So just want to, again, lift that up and reiterate that one more time.
Thank you for uplifting that as well. And I guess I'll pass this to Janet first. What barriers do you anticipate in disseminating this resource, and how might you overcome them?
Well, and I think I mentioned it earlier, the only true barrier I see for my community and the individuals and the organizations I work with is the fact that I have to get over that it's a public health publication. And that is honestly my only barrier, is getting them to understand that everything is connected to public health, and that by basically read past public health, now can you use it? And so far it has worked. But some of us were just kind of scary of the word, public health. Well, that's not me. But like I said, my community has been quite a bit more receptive than I expected. I expected more of my having to explain more to them and assist more, but they've been extremely receptive.
And Angela, same question for you.
Thank you for that question, Aaliyah. And I wouldn't necessarily, I don't want to say barrier. I think I'd use the word challenge. And challenge from the perspective of sometimes when you introduce something that's new to individuals or groups that they may not be familiar with, it becomes an opportunity for you to educate them, to inform them, and to help them see the benefit of it. For me, I think the toolkit is something that many of the communities that I work with will immediately embrace. However, I would like for them to then take this tool and figure out how they utilize it. What communication mode, what communication tools, how it is disseminated in the community. The tool is there, the tool is great, but again, how the community decides that it wants to utilize it is, to me, the challenge that we will work around, and not necessarily using challenge as a negative, but as the opportunity for engagement. And so I think, again, this is a valuable tool. This is something that I have not seen out in many of the communities that I've worked with in the past. And I feel certain that the communities that will have access to it, and which I hope that will be all of them, will see the benefit, will know the benefit, and will use it as the benefit that it is.
Beautiful. Thank you both. And my last question to wrap us, what's one word or phrase you'd use to describe the potential of this playbook? Whomever's ready can answer it first.
Well, I'll jump in, and I'm going to break the rules. I've been known to do that. And I'm going to say 2 words. And my 2 words are endless possibilities. Because I think this toolkit has endless possibilities. Right now, we are initially thinking about how we will use it. But I think that long term, it has the ability to be sustained beyond the limitations that we've created for it. And so I think that as new communities, as new leaders, as new opportunities will come along, that this toolkit or this playbook will evolve into something that we may not even have dreamed that it will be. But whatever it may be, it will be beneficial to the communities. And so endless possibilities are the 2 words that I'm going to give you about the playbook.
How can I follow that?
But you can.
I was just gonna give one word. Beneficial.
Yes.
I played almost by the rules.
You did almost.
No, that was great. Thank you both so much for the conversation, applying the playbook to your communities and your work, and answering the list of questions we had for you all.
And
for
may I
those-
please add that, one of the questions that we were asked was how to stay connected with you or support your efforts, right? And what I would like to do is put out an offer to anybody that is here, their organizations and such, that allow me to be a resource for you. If you're having difficulties, or if somebody in your organization, you're having difficulties and not able to make those connections with your governments, not able to get into certain different cultural organizations, feel free to get a hold of me. I'm super easy to find, and I'd be more than happy to have a chit chat with you and kind of help you, guide you through some of those things. And who knows, I may have connections where you're at. So I just wanted to put that offer out there.
Well, I can't let Janet put that offer out there without echoing the same sentiment. But I first have to say just how wonderful Janet was to work with when we were a part of the pandemic and the COVID-19 project. And again, she was just so resourceful, number one, but also so willing to just roll up her sleeves to connect us, to make sure that we had resources that we needed in Merced, California, to be able to address the pandemic. So thank you, Janet, an endless thank you for what you have done. But I also want to say echo or say ditto to what you just said about if there is an opportunity for me to support, to engage, to connect, to partner on some of the efforts that are happening with those of us who are around, who are part of this webinar, please don't hesitate to let me know and to reach out to see what we can do, because clearly there is more work to be done. There is so much happening on a daily basis in our community and across our country. And there are people who need the resources that we have, and we have got to be willing to share them and to roll up our sleeves and to help make a difference. So.
Agree.
Thank you so much. COVID-19 brought together people that usually work in silos. And I think you're examples of leaders who can work in and between those silos. And I know there's a lot of stories within stories, but that's the beauty of it, because every community is unique. One thing I think that Janet told me, she said, look for your community heroes. Look for, everybody has one. Trusted people that have a voice, whether it be the pastors at your church, whether it be that you're a doctor. Get them into this idea and uphold that representation of people that needed the services most in crisis. Sustain that. And that's one of the objectives that we hope does follow over. So I appreciate your comments both very much, and that you both came together today somewhat unexpectedly, brought a lot of good energy and focus on the matters. We appreciate it.
And I can't let you go, Alan and Aaliyah and Al and all the team, without saying thank you for all that you have done. And I know that you will continue to do to help people all across our country and across the world. And again, CCPH is unique. I haven't found another, your unicorn. I haven't found another one. And so I hope that you will continue to do the work that you will do, and you will continue to engage people like Janet and myself in that work, so that we can use our time, our tools, and our talents to make a difference. So thank you.
It's like you all are dropping the mic. I don't know. Cute. Like mic drop again. So just thank you so much for your time, those words, and yeah, spreading love. With that, I'm going to pass it to Alan Wells.
You know how everyone loves data. An evaluation would help us greatly if you would take a minute to complete this evaluation. We're going to play some music and let y'all hang out and have a look at that in the link attached. Can you see it? I'm going to demarcate it again. And let's have some music.
Before we play the music, I see a hand raised from Miss Dorothy Castillo.
Yes. Oh, Dorothy Castillo. Yes. Can we? Shoes, can you take off her mic? That's Dottie Castillo from the NIH.
Hi, Dorothy, do you have a question?
Dottie, can you hear us?
Sometimes these keyboards have a mind of their own.
Well, you can write it in the chat. Dottie was this big advocate of CENR and worked at the at the NIH as one of the main administrators of the study. And I think if I was to capture what she thinks about it, the scientific results of RADx-UP were spectacularly successful beyond the expectations of the NIH in reach and ability to reach, and the value of partnerships were articulated more. And she became a real advocate for that, even as you know what's happening with governmental programs being cut. We hope that we can focus on serving the people with less of a voice still and inspiring their innovation locally. Just in wrapping up, I'd like to thank you for your time today. We truly appreciate that. Feel free to reach out to Aaliyah or myself with more dissemination and questions or suggestions. Visit our website at CCP Health. And a heartfelt thanks to Marcus, Leah, and Crystal from Duke Clinical Research Institute and UNC Chapel Hill. What a great team and what a great experience this was in the power of local organization, the power of local innovation. And any concluding thoughts from the panelists, because your time is so valuable? The recording.
Alan, you're muted, but yes, the recording will be shared with everyone, as well as a one picture and reflection from Alan and Aaliyah.
You will get the recording, and sorry about my mute. Visit our website, connect with us. Connections are the key. Partnerships are the main deliverable mechanism for all of science, if you really think about it. And we appreciate y'all engaging in this and just saving people's lives and connecting people and keeping it going.